After months of student advocacy, we can expect to see several changes to the CHC next semester. Reed Ellman led the council that proposed these new policies.
Those changes include a mandatory student health waiver, changes to ensure the quality of care in the Colonial Health Center, including an electronic health record system. They're also going to be bringing on some new staff in the Office of Health Promotion and a new dietitian. Previously, students were capped at 6 hours of free mental health services. They're removing that cap to ensure that students have access to quality and affordable mental health care.
These changes were motivated by student concerns about affordability and access to health care at GW.
A lot of students maybe have health insurance that works for them in their home state, but it doesn't necessarily work here in DC. So figuring out ways that we can make sure that all students don't have to worry about being able to access care in DC and at the CHC.
Some students have expressed concerns that this new insurance mandate will force low-income students to buy health insurance they cannot afford. But Ellman assured me this is not the case.
There's been some misinformation out there about what the insurance waiver means for students. It does not require students to purchase the university's health insurance. That's just simply not the case. What it does is it requires university students to comply with federal law. The Affordable Care Act already requires that everyone have health insurance. This is simply bringing us in compliance with that federal law. For low-income students or students who might have issues paying for the plan but want it anyway, the university is committed to finding ways to offset the cost for students, whether it's through financial aid or grants, to make sure that students have the ability to afford the health insurance that they need.
I'm Devin Link, reporting for G Week.